Tonight, we are asking more questions about security at the Austin State Hospital after an arson suspect was able to run from that campus.
Kirill Belchenko is in the hospital after being declared incompetent to stand trial. And our Chris Sadeghi spoke with the Department of State Health Services about how they watch their patients. Chris.
Well, one of the things they told us is even though they have patients that may be suspects in crimes, that the Austin State Hospital is not a prison or a jail. It is still a hospital. They don't call these escapes, but rather unauthorized departures. Belchenko was charged with intentionally setting two fires, one at the Arboretum and this one with surveillance video at a Cedar Park bank. At the time of his arrest in December, there were 4 other Cedar Park fires where investigators thought he could be connected. He left the Austin State Hospital during a food delivery on Saturday. When we spoke by phone today, the department spokesperson wouldn't talk specifically about Belchenko, but she did tell us that each patient is given a risk assessment for several factors that help determine how much oversight or supervision to give that particular patient. Those factors include motivation or history of trying to leave, criminal history, or a history of violence and the potential of dangerous behavior or past drug and alcohol use. We also requested how often this happens. This fiscal year, since October, there have been 11 unauthorized departures. In the fiscal year of 2015, there were 14 departures for the entire year. They also told us that the general hospital staff is trained to treat patients, not to chase or restrain them. And if a patient runs, they are taught to use communication, try to get that patient to cooperate until they leave the campus, at which point they're told to call police.
Chris Sadeghi, thank you for that.
And the last time an Austin State Hospital patient walked away was just last month. John Michael Wilkinson was being treated at Seton Medical Center when he simply walked out. He'd been at the Austin State Hospital after he was found incompetent to stand trial in 2015 on trespass and harassment charges. Investigators found Wilkinson just a week later and returned him to the hospital.